Well, there has been a lot of politics and talk around the vaccine. So you remember that, the Zimbabwean people, don't trust the Zimbabwean government because they've made so many promises. We've heard the Minister of Finance saying that private citizens are going to pay for the vaccine. Then they said the vaccine was going to be free. Then they went out and called for private sector to help in securing the vaccine and pay for part of the vaccine. And now the president of Zimbabwe says China is going to donate part of the vaccine. And they're also talking about Russia giving them part of the vaccine. So there is a mixed feeling because mainly people don't trust Chinese vaccines. And so some people are not comfortable with that. But we will just wait and see because China is the greatest, bigger trading partner with Zimbabwe. I think the biggest investor currently, especially in the mining industry, and a good friend. So Zimbabwe is one of the few countries that is going to benefit from the Chinese drug program. And Zimbabwe has no choice but to accept because they have no other way of raising money to buy the vaccines.
At present, is there a plan that has been announced on how these vaccines will be rolled out and who exactly will be the first to get these jabs?
When it comes to the rollout, the communication has been poor because at one point, one of the officials said the MPs and the security were going to get the vaccine first. There was an outcry from the people, the public, and now we hear they're talking about the vulnerable, they're talking about the health workers, and they're saying at least 65% of the population is going to get the vaccine. So ideally, we expect that when they do get the vaccine, they should start with the health workers because they've been hard hit, especially by the second wave. We've seen doctors dying, we've seen nurses dying, and of course, those who are the risk, age groups above 65, people with conditions. We hope that is the order that they're going to follow.
So the coronavirus pandemic has increased quite rapidly in Zimbabwe over the past few weeks, with about 70% of its known 33,964 infections and more than two-thirds of the 1,269 deaths recorded since the beginning of January. What is the situation right now, Zenzele?
We have seen that, at least the last 2 or 3 days, the cases have gone down. Just today, they recorded that in the last 24 hours, 25 people or so died because of the coronavirus. But the numbers are going down. And in the last 3 weeks, especially in January, we went to a case where about 70 to 80 people were dying a day. And that was just too much. We know that our health system is also cannot, hold the number of people who are falling sick and needing attention. But I'm glad that the situation is improving. We are seeing numbers going down, and we hope that that will be maintained. So it just depends what next will be done. The lockdown has been extended to the 15th of February. So the question is, what happens after the 15th of February? Do people go back to normal and then the cases go back again, or the lockdown will be eased in stages, allowing the schools to open, so then they monitor the situation. But I would say in the last week or so, cases have been going down, and I hope that trend will continue.
So Zenzele, before we wrap up, as we outlined earlier, this Sinopharm vaccine is approved in China for general public use and is also being administered in a number of other countries. But do we have any more details about where Zimbabwe will be sourcing more vaccines?
From what we hear, the president of Zimbabwe has also talked about the possibility of getting vaccine from Russia. We've also heard the Ministry of Finance talking about setting aside over $100 million to procure vaccines, but there's not been specific where to get these vaccines. So we might have a situation where we are getting a bit of maybe 200,000 from China, another 300,000 from Russia, and another 500,000 from somewhere. And also we expect Zimbabwe to get vaccines through the World Health Program. So we might have a situation whereby we get a bit of vaccines from here and there, because in our situation, I don't think we have a choice. If someone offers a vaccine, we will take it.
But what's the health sector saying in the country? Are they optimistic about the rollout of these vaccines?
Currently, there is a lot of talk, and with Zimbabwean government, they've said so many things that don't materialize. I think we'll only, get the quite clear picture when the vaccine has landed, because they're just talking about. I'm certain that the vaccine that is going to come from China is going to actually be delivered, but we're only talking about 200,000 doses in a country with over 14 million people. So the health sector has been watching the case. They talk closely, hoping that they are going to get concrete details. But as it is now, it's not really clear how, at the end of the day, how many vaccines we are going to get from where and how they're going to be distributed. So the logistics of how this is going to be done is still very not clear.
Well, that was Zimbabwe-based journalist Zenzele Ndebele giving us some context there about plans announced by President Emmerson Mnangagwa to roll out some 200,000 vaccines.